Hi everyone, my name is Ryan Sinclair and I'm a faculty here at the Loma Linda University School of Public Health. I want to talk to you today about environmental vulnerability and some tools you can use to look at social vulnerability and environmental vulnerability in communities around the Salton Sea. Then I'm going to talk a little bit about asthma and some studies that have been done on asthma. So I'm using something called the ArcGIS story maps, and this is sort of like a presentation, a PowerPoint presentation. It allows me to go through some maps a little bit better. So this first slide here shows the 2018 Salton Sea level shortly before the mitigation water from the quantification settlement agreement was turned off. So this is the 2018 shoreline of the Salton Sea. This shoreline is from about 4 years ago, and it's one that people know pretty well. You could see this light blue area. This is probably the shoreline that's on the map, and that's a 2003 shoreline, while the other one is the 2018 shoreline. So what we need to know is who lives here and how many people live here. So what I was able to do is get access to where all the communities are around the Salton Sea. So this is the story of the people that live around the Salton Sea. There's a lot of people that live around the Salton Sea. There's sometimes media will come and the popular media will feature the Salton Sea as sort of a post-apocalyptic wasteland, and we don't want to hear that because the Salton Sea that we know has lots of people. So just to emphasize that, we can count up the amount of people that live within 10 miles of the Salton Sea, and that's over 40,000 people. And that's a 2010 census, so you know it's going to be more now in 2022. But this is the some of the data that I have from the 2010 census. 40,000 people in all of these communities, all the way from about Thermal, Mecca, North Shore, Salton City, and Calipatria and Westmoreland, not including Brawley. So that's 10 within 10 miles of the Salton Sea. But if you're going to include all of the Coachella Valley and then also all of the Imperial County areas down here, that's way over 500,000 people. That's way over 500,000 people. So that's within 50 miles, most of the time, much closer than 50 miles. You've got a lot of people living near the Salton Sea. So I just wanted to emphasize that for some of the further discussions we're going to have. So, how do you evaluate environmental vulnerability? So, looking at how people are exposed to environmental justice issues or health disparities is a real important type of public health topic or demography. And there's a fair amount of tools out there. One of the most famous tools in California is the from the Office of Environmental Health Hazard Assessment, the WEHA, is the Cal EnviroScreen 4.0. And that tool does a really good job on kind of looking at available data on pollution and contaminants in water, in air, and then also looks at population characteristics and income and other status of people in different areas. And bring overall, it builds an index based on those two things. And that tool is called the Cal EnviroScreen 4.0. The 4.0 one was just approved recently, and it's the most recent version of this. So there are some issues with this as it relates to the Eastern Coachella Valley. We've been, as advocates out here, as I've worked with advocates, we've been kind of on top of the Cal EnviroScreen because sometimes it doesn't necessarily show the true story of what's going on in the Eastern Coachella Valley. And that's because, oh, well, some people are attributing that because the Cal EnviroScreen is a tool that's based on pollution that you typically encounter in an urban area. It definitely has considerations for a rural area contamination, but it does have a lot more consideration for what's going on in the urban area. So sometimes with the urban area, you're going to get a better approximation of what's going on with the disadvantaged communities. We all know that there's pretty serious problems around the Salton Sea, but this shows it's in the 80 to 90th percentile, and That's pretty bad, but it's not as bad as that dark red color. And when you zoom out here, you see the dark red color. There's some in Brawley, but there's also some around here in San Bernardino, where I am right now, and then other areas of the state. But it's just not around there in the eastern Coachella Valley and the right south of the Salton Sea. So as you zoom out on this map, you can see that it does start showing it up in the Central Valley on some of these areas where there's a lot of groundwater contamination and a lot of other issues going on. And in the LA area, of course, there's lots of it there. But what I wanted to just show you is that this is one tool, and we moved on to find another map that might show the Salton Sea a little bit better in terms of showing the vulnerability there. This tool is from the Center for Disease Control, their agency for toxic substances and disease agency. It's registry. It's the ATSDR, and it has the Social Vulnerability Index, this SVI. And this Social Vulnerability Index, it shows that there's this kind of like dark purple area, and that's the 96 to 100% percentile there. And that's a pretty high number there. It's not necessarily built on environmental contamination. It's built on socioeconomic status, household characteristics, housing type, transportation availability, and racial and ethnic minority status. However, what's unique about it is that it shows pretty dark areas in either the top 90th or 96th percentile all around the Salton Sea. And if you're going to zoom out and look at other areas, you'll find them like some hot spots in Calexico, Brawley, and some other areas like in downtown San Bernardino. But the area around the Salton Sea is pretty well portrayed for having a social vulnerability. So that's good. It kind of allows us to get that accurate picture. So what I wanted to talk to you about today is about asthma. We did this study with the California Institute for Rural Studies and the Alianza in from 2014 to 2016. And we went around and interviewed over 1,500 people. We had a stratified, randomized survey, so we chose the houses based on the map and we numbered them, and we went out and did a really good job on sampling. And then we went out and asked them a series of environmental health related questions. These are some of the questions. This is the result for asthma. Our assessment of asthma was based on a couple of different questions that we had in the survey, but this is our overall assessment of asthma. And as you can see, that back then, the 2016 California prevalence of asthma was about a little above 10%, and in the Riverside County, it was a little over 8%. And so all of Eastern Coachella Valley for children, it was much higher. We had it above like 15.4%. But what happens is that in some of these other areas, it wasn't, and the adults especially, it was really low. And the reason why I'm saying kind of emphasizing that it is lower than we thought is because we know from some anecdotal evidence and from some personal experiences with just talking to people around the Eastern Coachella Valley that a lot of people supposedly have asthma. Yet when we do the studies, we don't see that. So this study actually did show that in the city of Coachella and the city of, or the census designated place of North Shore, we had high asthma there. And so that's good for children so that we know that the asthma rate is higher in North Shore, and also in the overall Eastern Coachella Valley. But we did struggle to show the a high adult level of asthma. So there's other studies that have happened a little bit more recently. There is a USC study, and that found that 22.4% of people in Imperial County have asthma, or actually in school children. This is the study down that I have as a reference down here. Assessment of respiratory health symptoms and asthma in children near a drying saline lake, and that was published in 2019. That study did went to parents of elementary school children and was able to get a prevalence of asthma for them. 22.4% is, again, that's much higher than the state percentage, and that's a pretty significant finding. These figures here are from a UCR and HARC study, which reviewed data for emergency room visits. And you can see these red zones for all these different types of um, asthma or respiratory disease or cardiovascular disease. The red zones are those are all up in like Palm Springs, Desert Hot Springs. They're not necessarily where we have those environmental vulnerabilities from the Salton Sea or other things. So they were able to show that the cardiovascular disease and others were significantly correlated with PM 2.5 and ozone. But like our Alianza study, they were unable to show that these health surveys and health studies from data that's available from either county or the HARC doing the survey, they were unable to show that that data that's available from actual door-to-door surveys or phone surveys is linked to the actual PM 2.5 or ozone or other contaminants. So that's the current struggle now. And from my experience in this, and also what they wrote about in their paper, there's further work that's necessary to be done to discover those sample biases. So those biases are things that affect how you interpret the data that's coming out of the surveys. From my experience out there, one of the largest issues with conducting a survey is either respondent reluctance or just the fact that the recall is inaccurate. We're relying on parent reported data. So we're relying on parents to say if their children have asthma or not. And in a lot of cases, they are either reluctant to talk about their children or they can't recall accurately. So, overall, I wanted to present all of this data because the current thinking is that there is pretty serious environmental issues going on around the Salton Sea, and we know about climate change and we know how the climate is going to impact the environment and impact our environmental health over the next several decades from the Salton Sea and other issues. But we, as of yet, still need to keep working and keep trying to get better health assessment data, especially on asthma, because asthma is one of those things that's going to go up based on deteriorating air quality, and we really need to have a better assessment of it. And so that's what I wanted to do. I wanted to show you some of the current data that's out there, and then also point to our study we did back in 2016, and just kind of show some of the struggles that we have to measure asthma and to also justify why much more work needs to be done.